Hi, my name's Dr. Martin Hamilton and I'm a Board Certified Veterinary Dentist located in Ontario, Canada. Today we're going to talk about the diagnosis and treatment of periodontal disease in cats and dogs. As we mentioned in our last video, periodontal disease is caused by an interaction between plaque on the teeth and the immune system's response to that plaque. We can't use the gross appearance of the tooth and the calculus to determine whether periodontal disease is present or not. Rather, we should be using periodontal probing or assessment of clinical attachment loss, as well as intraoral radiographs, or in some cases, especially in brachycephalic or short-faced dogs and cats, the use of cone beam CT to help diagnose periodontal disease. Once we have evaluated each tooth with both clinical attachment loss and periodontal probing, as well as intraoral imaging, we can come up with a treatment plan for each tooth based on multiple factors, such as the patient, the owner and their ability to provide home care, and the pet's health status. Once we've evaluated the tooth with intraoral imaging and periodontal probing, we can assign the tooth a periodontal disease index number. The first stage of periodontal disease is known as PD1 or gingivitis, which is the only reversible stage of periodontal disease. Teeth with PD1 or gingivitis are typically treated by performing a professional cleaning both above and below the gum line to remove plaque, which is one of the inciting causes of periodontal disease. Once the teeth have been professionally cleaned, owners can often maintain this periodontal status by performing oral home care such as daily brushing and using VOHC approved products to help minimize plaque and calculus accumulation going forward. The second stage of periodontal disease is known as PD2, which is defined as the tooth having 0 to 25% clinical attachment loss or having stage 1 furcation exposure, which means that the furcation, the space between the roots of a multi-rooted tooth, has started to become visible. Teeth with PD2 or stage 2 periodontal disease can be treated by performing a professional cleaning both above and below the gum line, and in some cases teeth may require to be treated by open or closed root planing. Stage 3 periodontal disease is defined as a tooth having between 25 and 50% clinical attachment loss or bone loss. There may also be stage 2 furcation exposure, meaning that there has been bone loss within the furcation between multi-rooted teeth and a probe can be passed partly through that furcation. Teeth with stage 3 periodontal disease may be treated by extraction for smaller, less important teeth, or for larger, more functional and important teeth, we may consider open or closed root planing or even guided tissue regeneration depending on the pattern of bone loss present. Stage 4 periodontal disease or advanced periodontal disease is defined as a tooth having greater than 50% clinical attachment loss, or stage 3 furcation exposure, meaning that the bone within the furcation has been lost and an instrument can be passed through the furcation. These teeth are prone to developing even more advanced periodontal disease over time, are difficult or impossible to clean, and therefore extraction is recommended. There are very few cases where the tooth is not mobile, and there are certain patterns of bone loss whereby we can perform guided tissue regeneration in order to salvage a tooth, but these situations are very rare. In most cases, these teeth are uncomfortable or even painful and may be causing infection, and therefore extraction is the best course of treatment for the vast majority of patients. It is important to bear in mind that although a tooth may be solid and not moving, the tooth may actually have advanced periodontal disease, so mobility of a tooth cannot be used as a sole indicator for extracting or retaining a tooth. Highly mobile teeth generally have advanced periodontal disease and should be extracted, whereas teeth with no mobility can either be healthy or may even be severely diseased. There are multiple factors that can sway the decisions for treatment that I've already discussed. For example, if a client or pet owner is unable to brush teeth going forward, then we may choose to be more aggressive with our extractions. Likewise, if a pet has pre-existing health conditions that may prevent us from performing anesthesia at a later date, we may consider more aggressive therapy. Additionally, if a patient only is going to have a few teeth left at the end of the procedure, we may choose to extract the remaining teeth even if they're healthy, to prevent the patient having to undergo anesthesia at a later date.